Hi, and welcome to the 2015 Bloodborne Pathogen Training Program for the Boone County Fire Protection District and Missouri Task Force 1. How could you contract a bloodborne pathogen disease at work? The first thing that comes to mind, of course, is when we're administering first aid or care to any of the victims that we encounter through the fire district or the task force. What about when we're cleaning restrooms or cleaning other areas where bodily fluids might be? What about using a tool that's covered with dried blood? What about when a patient coughs on us? Any number of different ways that we could come in contact with bodily fluids may well give us an exposure that might cause us to contract some of these diseases. The goal of this class are simple: to give you the basics about bloodborne diseases, to talk about exposure prevention, and then take a quiz at the end. What are bloodborne pathogens? They're microorganisms present in human blood that can lead to disease. Diseases like HIV, the human immunodeficiency virus, hepatitis B, and hepatitis C. There are numerous other diseases, and here in 2014 and 2015, we're very concerned about Ebola, but HIV, hepatitis B and C are far more prevalent here in the United States. Human immunodeficiency virus, or HIV. HIV leads to AIDS, the autoimmune deficiency syndrome. It depletes the body of its immune system. Without the immune system, it can't fight off simple viruses that it normally would. HIV itself does not survive outside the body very well. Matter of fact, within a matter of minutes in direct sunlight, or in an hour or so in darker, moist environments. We can find it in saliva, tears, sweat. With hepatitis B, 1 in 1.25 million Americans are chronically infected with hepatitis B. Symptoms include jaundice, fatigue, abdominal pain, loss of appetite, and intermittent nausea and vomiting. May lead to chronic liver disease, liver cancer, or even death. And there's been a vaccination available since 1982. Hepatitis B can survive for at least 1 week in dried blood outside the body. Hepatitis C is the most common chronic bloodborne infection in the United States. Symptoms include jaundice, fatigue, abdominal pain, loss of appetite, intermittent nausea and vomiting. Can lead to chronic liver disease or even death. What are some of the potential bodily fluids where we can get an infection from? First thing comes to mind is blood, saliva, vomit, urine, semen or vaginal secretions, skin, tissue, cell cultures, or other bodily fluids. The potentials for transmission: anytime we come in contact with another person's blood or bodily fluids that may contain blood, mucous membranes, eyes, mouth, nose are good ports for those kind of materials to enter into the body, or non-intact skin, an open cut or lesion. And when we're responding to emergency calls where ALS care is being provided, the potential for contaminated sharps and needles, or in homes where people have needles like diabetics. So we want to make sure that we understand that those are the potentials for transmission of bloodborne pathogens to us. Industrial accidents may well count when we're administering care to the victims that we respond to. Post-incident cleanup and janitorial maintenance work where there might be blood or bodily fluids. We have to develop a plan to limit the amount of potentials for exposure to us. We've got to determine what kind of the environments that we might enter, and then understand what potentials we may have to take to protect ourselves. We have to develop safe work practices to prevent all potential exposures. We got to make sure that once we are done with rendering the care, that we can decontaminate our equipment, and we select and properly use appropriate personal protective equipment. We need to handle bio-waste and make sure that we not only clearly define it, but make sure it's properly disposed of. And we need to train. We need to talk about the potentials that are out there, as we've done through 2014, but also making sure that we continually train and understand the need for all the exposure control plan that we have listed out. And in record keeping. Record keeping of where our responses are, what our PPE are, and then we're constantly looking at the after actions of what we do so that we can make sure that we're safer in our future practices. Who must be trained? You. All employees with occupational exposure to blood or other potentially infectious materials. If you're a member of the Boone County Fire Protection District, you're a member of Missouri Task Force 1, that is a potential. If you're trained in first aid and CPR, it's a potential. Universal precautions. Anytime that we encounter blood or bodily fluids, we should suspect that they're contaminated. We make sure that we do a proper cleanup of ourselves and decontamination of not only our outer garments, but as well our equipment. We've got to make sure we're wearing the appropriate protective equipment. Anytime that we're dealing with any kind of bodily fluids, we should be wearing our protective gloves. In our case, we wear nitrile gloves. In some cases, they may be latex gloves. Anytime there's a chance for any spurting or splashing of bodily fluids, we should not only be wearing our gloves, but some kind of protective clothing that doesn't allow for the bodily fluid to soak through our clothing to us. There should be some kind of respiratory protection, be wearing our N95 masks, and wearing eye protection, the glasses or goggles that we've been issued. And while we're doing any kind of post-incident cleanup or decontamination of our equipment, we'd want to make sure that we're wearing the appropriate PPE as well. When we're doing decontamination, we want to make sure that we're wearing the appropriate protective gloves. We're going to use disinfectant cleaners to provide in our decontamination kits. On the hazmat truck, we have the hospital-grade Clorox wipes. In some cases, we may use other Clorox wipes, the regular standard household type, or a 1/4 cup bleach to one gallon of water. We want to make sure we properly dispose of any contaminated PPE, towels, and rags. We want to make sure that we have safe work practices. Remove contaminated PPE or clothing as soon as possible. We want to make sure that we clean and disinfect contaminated equipment and work surfaces with appropriate cleaning solutions. We want to make sure that we thoroughly wash our hands immediately after exposure. When we take our gloves off, we wash our hands. And before we encounter patients, we wash our hands. And post-incident, we wash our hands. Personal hygiene is one of the most important tools we have to protect ourselves from infectious diseases. And we want to make sure that we properly dispose of contaminated items. Any liquid or semi-liquid blood is potential infectious material. Anything that's used to soak up that can be compressed and squeeze it out may well be and should be properly disposed of. When we're working with ALS units or providing ALS care, the potentials for contaminated sharps are there. And we must make sure that we're properly storing them in our sharps gator or other sharps containers that we have available to us. Labels and signs. We should be using our red biohazard bags that clearly have the biohazard waste symbol on them. We want to make sure that we properly label. In our hazmat plans or in our EID plans, we currently have the biohazard tape to clearly show that an overpack barrel with contaminated PPE and equipment does contain biohazard. We want to make sure we're looking at proper containers for the biohazard waste and contaminated sharps. And we want to make sure that the containers used to store and transport or ship blood are OPM. We have blood products that go up and down the highways, so we may well encounter there. So looking for those labels and signs. As I said earlier, hepatitis B vaccination has been around since 1982. It's strongly endorsed by the medical community as a way to prevent ourselves from becoming contaminated or becoming infected with the hepatitis B virus. It's shown to be safe for infants, children, and adults, and it's offered to all potentially exposed employees. It's provided at no cost to employees. And under the new Affordable Care Act, your insurance company now should provide that for you at no charge to you, because it is a vaccination to protect yourself. You have the right to decline at any time. You'll need to sign a form that says, I don't want the hepatitis B vaccination, but you understand that you're taking the risk of becoming contaminated with hepatitis B should you truly become infected with it. There is a cross-section of folks in this nation that have taken the hepatitis B vaccination once or twice and yet never converted with the antibodies to protect them from that. In this small cross-section of folks, even though they've tried, they can't receive the protection from the vaccine. Exposure incident is a specific incident of contact with potentially infectious bodily fluids. This is a case where the individual is actually coughing, and globules actually not just hit your clothes, but actually has the potential of actually going in through the mucous membrane of the eyes, directly into your mouth, up your nose, or through open cuts or lesions on your body. If there's no infiltration of the mucous membranes or open skin surfaces, it is not considered to be an occupational exposure. Just because you're in the room and outside of 6 feet of that individual doesn't necessarily mean that you're exposed. You may well do, in your risk assessment as you're approaching the patient, decide that you need to go within a 6-foot circle of that individual to render care. But you should be, as you're doing your risk assessment, adding to your levels of PPE and protecting yourself as you go in there. If you do accidentally come in contact with blood or bodily fluids that make contact in through your eyes, through your nose, into your mouth, or through an open cut or lesion, make sure you properly report that. For Missouri Task Force 1, that would be directly to any of the medical specialists or medical team managers, your safety officer, or your direct supervisor, who then should report to the safety officer as well as the medical team. For Boone County Fire Protection District, you'll need to make sure you report that directly to whoever your direct supervisor is, your station commander, your station officers, or the incident commander. Somebody then needs to contact the duty chief, who will then in turn contact the fire chief, the administrative bureau director, and the chairman of the Health and Safety Committee. From there, then we'll help guide you into either appropriate medical care, or we'll start working with the infectious disease folks to find out whether there's something that we need to be concerned about, or whether or not this is something that you really don't have to worry about. Either way, without properly reporting this immediately upon exposure, we can't get you the help fast enough. And then post-exposure medical evaluations are offered. You get a needle stick from a contaminated needle. If you did get, you weren't wearing your eye protection as you should have been and got blood directly into your eye, then we will do post-analysis, and we will draw labs, or get you to the hospital where they'll draw labs and then post labs subsequently down the road to make sure that whether or not you have developed potential for an infectious disease. With those post-exposure evaluations, you've got to remember, too, that those are confidential. Once we hand you off to your medical care provider, that's going to be between you and them. In many cases, though, if let's say we've got a motor vehicle accident where somebody did get directly contacted with another patient's bodily fluids directly into their eyes or their nose or the mouth or through an open wound or lesion, then in that case, then we'll contact the infectious disease control folks, and then we'll start working with finding out whether that person had any diseases that we need to be worried about for you and making sure we're getting you the proper care. We want to make sure that we properly document the route of exposure. Was it a needle stick? Was it a splash that got into your eye? Identify the source individual. It's going to be very important that that we try to find this out so that we can look at confidentially. The proper authorities can look at the fact of, does this person is perfectly healthy, or does this person have something like HIV or hepatitis B or C? And then they're going to have tests of you, tests of the patient. Of course, all this is with their consent. And then provide results to exposed employee. If you are exposed to the blood of somebody that has HIV or other bloodborne pathogen, you have the right to know, but in the same token, we've got to know that you were exposed so that we can make sure we're doing the proper prophylactic and as well as the proper care. We got to make sure we're doing good record keeping. Medical records include hepatitis B vaccination status. So with our annual health physical, we ask you to make sure that you bring your shot records, and if there's any additional immunizations or vaccinations that you're taking, that we have that in your record. Again, it's confidential with our occupational health physician. Any post-exposure evaluations or follow-up results. We need to make sure that these records are yours and they're kept confidential. If you share them with anybody administratively, we are mandated to keep those confidential as well. But primarily your healthcare physician and our occupational health doctors will be the only ones that will have direct access to that information. And then with training records, so we're going to look at the fact of when did you get trained on how to prevent and wear your proper PPE, how to prevent exposures. We're looking at the content of the training. Did we cover the things that you needed to do to protect yourself ahead of time and the potential dangers that we may well encounter? And then we're also going to look at the fact of who our trainers were. Again, for bloodborne pathogen, the goals were to talk about the basics of bloodborne diseases. What are some of the true risks of different types of bloodborne pathogens that are out there, things like HIV, hepatitis B and C. We talked about the potentials for exposure prevention. What are some of the primary things that we need to do to protect ourselves when we respond to victims or are decontaminating or cleaning up post-incident. And now, at the end of this program, we're going to ask you to go ahead and take a quiz. So in summary, remembering that the number one way that we can prevent exposures are, first off, hand washing is the number one tool we have available to us. Secondly, wear your PPE. You were issued goggles and safety glasses. We have respiratory protection in the N95 mask or our other respiratory protection equipment, the full-face SCBA with the adapter and P100 cartridge. We have impervious gowns, or in some cases, in our infectious disease precautions, we actually have level B suits that we can wear. So gloves, eye protection, respiratory protection. Making sure that you understand that many of these diseases have vaccinations that are available to you and that you avail yourself of those if you're so inclined. But understand if you do decline them, you set yourself up for potential of risk. And diligence. Anytime that we can potentially encounter a blood-borne pathogen in any kind of bodily fluid, we should be conscious of that, predict the environments that we may go into, and then protect ourselves. You must wear your PPE. Gloves, eye protection, respiratory protection, impervious gown, long sleeve shirts, pants, and closed-toed shoes or boots. Thank you very much. Now, I'll ask you to take the quiz. Again, all you got to do is take the quiz. Once you're finished, you're done. You don't have to notify us. It'll notify you whether you passed or failed, and you'll also will have the record here to where we can keep track of that ourselves. Thank you very much for taking the 2015 Bloodborne Pathogen Training.